So if you want to catch up with any that you've seen before, then please go onto our website. It's cmthub.co.uk. There we go. So today we have got, if you coming to us for the first time, a lively and insightful discussion. So get comfortable. You can turn your microphone off and your cameras. Don't worry about those, and we'll gather your questions now. And after the first 10 minutes, we'll have a Q&A where we won't be recording, so you can have a much more open and honest conversation. Well, I'm delighted to welcome Ewan Armitage, one of our very own. He is an advanced practitioner in primary care and lead advanced practitioner for Cheshire Merseyside Training Hub, with over 15 years experience and practicing as an advanced practitioner since 2018. Ewan is going to be sharing today what advanced practice looks like in primary care, the challenges involved, and how it can drive real quality and improvement. So thanks so much for being with us here today, Ewan. Shall we get started?
Yeah, nice to see you, Karla. Hi, everyone.
So tell me, what is advanced practice?
Well, advanced practice, Karla, is a level of practice. So it doesn't relate to a specific profession, such as nursing or paramedics, and it's not specific to primary care. So there are advanced practitioners working in all areas of the health service. So as the title suggests, it's an advanced level of practice, which is characterized by a higher level of clinical skills and expertise. And it's a comprehensive knowledge base which lends itself to more complex decision making. And it's typically delivered by experienced health professionals, regardless of their core professional registration, who are able to practice autonomously and have an ability to provide both clinical leadership and demonstrate a measure of influence with their employer as to shaping the services that they provide to patients. So each regulator, such as the Health and Care Professions Council and Nursing and Midwifery Council, they will also have their own standards for the designated professions, but in very broad terms, these will reflect the national model for advanced practice, which is based around the 4 pillars of advanced practice, which are clinical, education, research, leadership, and management.
That's really good. So if it's a national model, then do all of the advanced practitioners have the same skill set?
No, that's not the case. And you will have heard the phrase scope of practice, and that applies to advanced practitioners as it does to all clinical grades. So even in primary care, advanced practitioners have different clinical skills, such as their ability to review pediatrics, see female health presentations, mental health, and so on. But it depends on what the clinician is competent to do at an advanced level of practice. But what is a common denominator for all the advanced practitioners is their ability to work autonomously at level 7, safely, competently, and appropriately within their scope of practice. So this can change over time as the advanced practitioner gains experience and undertakes additional CPD and becomes more confident in supporting a broader range of clinical presentations. But this should be clearly defined and agreed with their employer.
So it could be a huge variety there.
Yeah, absolutely.
So you've mentioned level 7. What does that mean? Is that band 7? Is that master's level 7? What is that?
Okay, so in academic terms, Karla, a level 7 qualification is a master's degree or equivalent. Now, anybody who has a master's degree or is working towards it will tell you the emphasis is not on memorizing stuff for written exams. It's about applying that knowledge in practice and applying the critical thinking and problem solving to their clinical practice. So when you hear the phrase working at level 7, that is what it means. It's an ability to practice with an extended set of clinical skills and demonstrate that complex decision making and problem solving to ensure the best outcome possible for patients. And it aligns with the framework for higher education qualifications at both an academic and a professional level.
So what you're saying then is that a master's degree in advanced practice, is that not enough?
No, it's not enough. And to be honest, Karla, it never has been. because advanced practice comprises both the theory and the clinical skills. Okay, now universities which have been approved to deliver programs in advanced clinical practice, they will typically have a work-based component included in that, and that means that the trainee advanced practitioner, she has to demonstrate their ability to apply the theory appropriately in practice. Okay, so usually this comes in the form of some kind of endpoint assessment, which can be completed in tandem with the more academic or the written mode of assessment at university, although some programs may differ in how that's done. So in some cases, a trainee advanced practitioner, they may have to demonstrate that competence after they've completed the master's program, and both the trainee and the employer would work together to ensure that. But it is important to recognise that advanced practice is more than an academic award. It's the ability of the clinician to apply that learning in practice, and that cannot be assured by a master's degree alone. So another thing to remember, Karla, is that some clinicians are able to demonstrate that they've been working at an advanced practice level without a master's degree at all. So you may have heard of the e-portfolio route. Well, this is where a clinician, they can provide evidence spanning a number of years which show their level of practice is commensurate with level 7 working, and that they are employed in that capacity. So typically it's for those who've previously undertaken a non-accredited program or completed their advanced practice education prior to 2017.
So, you know, how does an advanced practitioner then prove that they're competent, that they're safe?
So the accepted way to do this is with a portfolio of continuing professional development, and this can be paper-based collection of evidence, can be electronic portfolio, or some sort of increasingly online type of format. There are a multitude of platforms that you can choose from, but regardless of that, portfolios must demonstrate that an advanced practitioner is working at a level of practice and scope of role which covers all of the 4 areas of advanced practice.
It's really interesting. I mean, you hear lots of kind of like myths, don't you? Especially within primary care, and people are working so differently in each practice and PCN. One of the things that I often hear is around sort of that prescribing. I hear that advanced practitioners can prescribe medicine. Do you need to have prescribing rights to then be an advanced practitioner?
So that's a very common question, Karla, and the answer to that is no. Okay, so the ability to prescribe medicines does not define advanced practice, and the new multi-professional framework does not specifically require health and care professionals to prescribe in order to practice at an advanced level. So employing organisations may require prescribing for some of their roles, but it does not confer advanced practice, nor is it a mandatory component of it.
So there's again different variations of what you can do depending on your employer. So while we're talking about different titles, why have we been talking about advanced practitioners and not advanced clinical practitioners, ACPs?
So that's a very recent change which was brought in with the publication of the revised multi-professional framework in May of this year. So the word clinical has been removed in order to reflect the fact that advanced practice is a level of practice and not specific to an individual profession. So by referring to advanced practice rather than advanced clinical practice, it's thought that this distinction has been made clearer.
So more changes, more paperwork changes, website changes for us to show up to date.
That's right.
Well, so the final question then is, we know that you're the advanced practice lead for primary care in Cheshire Merseyside, but what does that mean in terms of what the training hub does and what we have?
So the important thing to remember is that the training hub is here to help, isn't it? I don't see our role as some form of enforcer or being responsible for policing professional standards with regards to advanced practice. So as a training hub, we are there to advise on best practice, highlight national frameworks, policy drivers, prescribed governance standards. That's the key thing for me, Karla. And that's the approach I very much take with employers when I have regular conversations with them and advanced practitioners, including those that are in training. Goodness knows there are enough people telling primary care what it should be doing. But advanced practice really can make a difference. And it's important that myself and my colleagues at the Training Hub, like yourself, do what we can to see the integration and sustainability of advanced practice in primary care.
That's brilliant. I mean, what really stood out for me is that advanced practice isn't just about this single profession or having a master's degree.
Yeah.
It's that level of practice that's described by how autonomous you are, what your critical thinking's like,
That's right.
and as you say, that sort of leadership and improvement component. So I'm going to stop it there. I'm going to stop recording. And hopefully we've got